Think you're healthy because your blood work came back normal? Not so fast. Standard lab panels often miss the early warning signs of chronic disease. Today, I'm giving you the top 5 advanced health tests your doctor probably isn't ordering, but absolutely should. First up is fasting insulin. Most doctors test fasting glucose, which is blood sugar, and hemoglobin A1C to monitor blood sugar. But these tests only show you a snapshot and short-term picture respectively. Fasting insulin shows you what your body is doing long-term behind the scenes. Insulin resistance often begins 10 to 15 years before your blood sugar ever goes up. High fasting insulin, above 8 microunits per milliliter, is a red flag that your body is overcompensating to maintain normal glucose. The optimal range for fasting insulin is 2 to 5 microunits per milliliter. This test can uncover metabolic dysfunction long before it shows up in standard panels. If you care about preventing diabetes, obesity, or even Alzheimer's, fasting insulin is non-negotiable. By the way, if you're finding this information helpful, don't forget to like, subscribe, and hit that notification bell to help me continue creating more content like this for you. Number 2, the coronary artery calcium score, or CAC scan. This isn't a blood test. It's a non-invasive CT scan that detects actual calcified plaque in your coronary arteries. Unlike cholesterol levels, which estimate risk, the CAC score shows you if you already have heart disease. A score of 0 means low risk. Anything above that deserves attention. If you're over 40 and want to know your true heart disease status, this test can be a game changer. Third is C-reactive protein, or CRP. Specifically, you want the high-sensitivity version, or hsCRP. hsCRP is a marker of systemic inflammation, which is a root cause of heart disease, cancer, diabetes, and even depression. Chronic low-grade inflammation can quietly wreak havoc for years. If your CRP is elevated, it's a sign your body is under stress, possibly from poor diet, overtraining, autoimmune issues, or hidden infections. Coming in at number 4 is LDL particle size and count. Standard tests only show your total LDL-C, but that's like counting how many cars are on the road, without knowing if they're compact cars or 18-wheelers. Small, dense LDL particles are more likely to penetrate artery walls and contribute to plaque buildup. But large, fluffy LDL, far less dangerous. The advanced lipid panel provides a deeper insight into cardiovascular risk. If your LDL is high, knowing the particle size and number can help you and your doctor decide whether it's actually a concern or just a normal adaptation to a low-carb diet. Last, but definitely not least, ApoB, or apolipoprotein B. Every LDL and VLDL particle carries one ApoB protein, so ApoB tells you the number of atherogenic particles, not just how much cholesterol they carry. Research shows ApoB is a better predictor of heart disease risk than LDL-C alone. In fact, some experts argue it should replace LDL entirely in lipid panels. Especially if you're on a high-fat or low-carb diet, ApoB gives a clearer picture of what's really happening inside your arteries. Look, just because your labs are normal doesn't mean you're in the clear. These 5 tests, fasting insulin, CAC score, CRP, LDL particle size, and ApoB, can reveal early warning signs that standard panels simply miss. Ask for them, advocate for them, or order them yourself if you have to. Because when it comes to your health, normal isn't always optimal. I'll leave a link to an advanced health test summary sheet in the description below, so you can see which, if any, of these tests are typically covered by most insurance, along with cost estimates if you decide to pay for them yourself. Drop a comment if you've had any of these tests done, and what they revealed to you and your provider. Live your healthiest life, and I'll see you in the next one.